Alright, let's dive into something that's been on my mind lately, and I think it's going to spark some serious conversation. Did you know that Massachusetts is one of just 6 states in the entire U.S. that hasn't joined any of the interstate licensing compacts for mental health professionals? Yeah, it's wild. And personally, I think this is a huge oversight, especially in the age of telehealth. I mean, think about it. If you're a therapist in Massachusetts and your client moves to another state, suddenly you can't legally continue treating them unless you have a license in that state too. That just doesn't make sense in 2023. What makes this really interesting is the broader implications. This isn't just about convenience, it's about continuity of care. Imagine having to switch therapists every time you move or even travel for work. That's not just annoying, it's potentially harmful. As Rebecca Guertz pointed out, having to terminate a supportive therapeutic relationship because of state lines feels outdated. And honestly, I couldn't agree more. We're living in a world where you can work remotely from anywhere, but your mental health care? Still stuck in the 20th century. Now, let's talk about why Massachusetts is lagging behind. One big reason is opposition from some unions and concerns about how other states' licensing standards compare. I get it, standards are important. But here's the thing, these compacts aren't about lowering the bar. They're about streamlining the process for qualified professionals. And what many people don't realize is that each compact has its own commission, made up of representatives from participating states, to ensure quality and accountability. It's not a free-for-all. Another detail I find fascinating is the cost barrier for therapists. Allison Malkin, a social worker, shared that she maintains licenses in 5 states, and the fees are no joke. Hundreds of dollars per state, plus renewal fees every few years. That's a lot of money and time. The compacts, on the other hand, charge a much smaller administrative fee. If you take a step back and think about it, this isn't just about therapists, it's about access to care for clients. If therapists can't afford to maintain multiple licenses, fewer people get the help they need. But here's where it gets even more complicated. Some lawmakers, like State Senator John Keenan, have reservations about the full impact of these compacts. He's concerned about comparative training and educational requirements across states. And that's a valid point. But in my opinion, the benefits outweigh the risks. Continuity of care, expanded access, and easing workforce shortages? Those are pretty compelling arguments. Plus, if Massachusetts joins, they'll have a seat at the table to shape the eligibility requirements. What this really suggests is that we're at a crossroads. Telehealth is here to stay, and mental health care needs to catch up. I mean, think about college students, military families, or people who travel for work, they're the ones most affected by these licensing rules. Abby Weeks, a college student, shared how she went a month without her prescription medication because she couldn't find a provider in her hometown. That's not just frustrating, it's unacceptable. This raises a deeper question, why are we still treating mental health care like it's bound by geography? If you're the same person with the same issues, why should your location matter? Megan Snyder, who had to disrupt her care while traveling, put it perfectly, I'm still the same person. I'm still having the same issues. Exactly. From my perspective, this isn't just a policy issue, it's a human issue. So, where do we go from here? Massachusetts has already adopted the Nurse Licensure Compact, so it's not like this is uncharted territory. And State Senator Robin Kennedy is pushing for the Social Work Compact, which gives me hope. But it's going to take more than hope, it's going to take action. Personally, I think this is a no-brainer. Joining these compacts isn't just about modernizing care, it's about recognizing that mental health doesn't stop at state lines. One thing that immediately stands out is how this issue connects to bigger trends in healthcare. We're seeing a push for more connected, coordinated systems, and these compacts are a step in that direction. Adam Del Molino from the Massachusetts Health and Hospital Association called them a highly valuable tool to modernize patient care access. I couldn't agree more. But it's also a reminder of how fragmented our systems still are. If we can't even agree on this, what does that say about our ability to tackle bigger challenges? Closing thought, this isn't just Massachusetts' problem, it's a national conversation we need to have. Mental health care should be about meeting people where they are, not where they're licensed. So, here's my question to you. If we can work remotely, shop remotely, and even date remotely, why can't we get therapy remotely without jumping through hoops? Let me know what you think in the comments. I'm all ears.